Okay, let's unpack this. Um, Imagine you're in the hospital, right? You're focused on getting better physically, maybe recovering from surgery or an illness. But what about the other stuff? The emotional side, the behavioral impact of being there. Today we're diving deep into a new study. It really shines a light on something often overlooked in hospital care, how physicians actually view health psychology consultation services.
Yeah, it's fascinating. This study, it was in the Journal of Clinical Psychology in Medical Settings just this February 2025, Palmer and colleagues. And what's really interesting is they went straight to the doctors themselves. So our mission here is to pull out the key nuggets. What do physicians actually need? And maybe why do they prefer certain things from health psychology? The goal is figuring out how to, properly integrate this mental health support into the really intense inpatient setting.
Right. So before we even get to the solutions, let's talk about the problem this research started with, because it's kind of eye-opening. The sheer number of patients in the hospital, for medical reasons, who also have psychiatric or substance use issues, it's huge. The source gives this startling statistic, adult medical admissions, with one of these co-occurring conditions. It actually jumped from like 35.7% in 2010 up to 42.4% in just 2014. That's wow.
It is a big jump. And, the study doesn't delve deeply into the why of the rise itself. It's more focused on the consequences. But connecting the dots, it's crystal clear these aren't just like side issues you can ignore. They really mess with managing the primary illness. The study links them to longer hospital stays, more readmissions, higher mortality, higher costs. It's a whole cascade. And think about this. Psychiatric disorders were even linked to a higher risk of ending up in the hospital or even dying from COVID-19. So it just hammers home how vital it is to tackle these behavioral and mental health needs proactively, not as an afterthought.
That makes total sense. Okay, so that brings us to the health psychologists. Where did they fit in? Because I think a lot of people, when they think mental health in hospitals, they immediately think psychiatry.
Yeah.
So what's the specific role of a health psychologist here? How's it different?
Right, good question. Psychologists, especially the ones doing consultation liaison or CL work, they kind of have two main jobs in these medical settings. One is direct clinical work with the patients and their families, using different diagnostic tools, different therapies, but they also work indirectly, consulting with the medical teams, talking about behavioral issues, ethical stuff, psychosocial factors. They help patients deal with the cognitive side, the behavioral, social, emotional things that are tangled up with their illness or why they're even in the hospital. And crucially, they give psychological tools, interventions to help people cope better.
Okay, that dual role, direct patient care and consulting with the team, that feels really important. Do you get the sense physicians really grasp that distinction day to day, like in the heat of the moment? And what specific problems are actually triggering those calls? What are doctors seeing that makes them reach out for a health psych consult?
It's a fair point about grasping the distinction. The study actually found that most docs felt pretty confident telling the difference between health psychology consultation services, let's call it HBCS in psychiatry, or social work, or spiritual care. Where it got a bit fuzzy for some, about 42.9% weren't confident, was distinguishing HBCS from neuropsychology referrals. So there's some overlap there, maybe in perception. But as for why they call, another survey, Legrat et al.'s from 2024, looked at CL psychologists. The top three reasons were helping patients adjust to their illness, dealing with depression, and managing anxiety. Basically, helping people handle the emotional roller coaster of being stuck in the hospital. And the difference from CL psychiatrists. Psychiatrists often focus more on the diagnostic side, maybe prescribing meds or other clinical recommendations. CL psychologists, they're assessing all those cognitive, behavioral, social, emotional factors, and then providing the psychological interventions, the coping strategies to boost well-being.
Got it. So with those roles kind of laid out, let's get to the core of this study. What did the physicians at this big 743-bed academic medical center actually say? What did the survey reveal about how they feel about these HPCS services?
Yeah, this is where it gets really telling. A big takeaway. Almost half, 49% exactly, of the doctors surveyed thought their hospitalized patients could benefit from a psych consult. That's significant. And when they drilled down into specific problems, the things doctors most often saw a need for were help coping with the hospital stay itself. That was huge, 83.7%. Then managing depression or anxiety, that was 69.4%. And just needing extra emotional support or counseling, 63.3%.
Okay, so they see the need. But how do they want to interact? You mentioned integration earlier. How did they prefer to communicate with the psychologist? This sounds critical for making it work smoothly.
Oh, absolutely critical. And the results were really clear on this. It wasn't just about, checking a box in the electronic medical record. Far from it. Physicians overwhelmingly wanted direct, interactive conversation, the top preference. Getting paged by the psychologist to actually talk about the case over the phone, that was 60.4%. Next was meeting in person, 26.5%. Only a small fraction, 12.2%, preferred only using the electronic health record. You can almost feel the desire there, right, for a real conversation, not just another note to read. That back and forth allows for actual collaborative problem saving, sharing insights. It's just fundamental for good, efficient teamwork.
That really speaks volumes. It's not just data entry, it's collaboration. So if they want that interaction and see the need, what's getting in the way? What were the biggest barriers stopping them from making referrals? And maybe more importantly, what do they say would make them more likely to refer?
Okay, the barriers. Two big ones stood out. First, delays in getting a response to the consult requests, often because of staffing issues. That greatly affected things for 55.6% of them. Second was the feeling that the health psychology service just wasn't integrated enough with the medical teams. That was a major factor for 43.5%. One doctor actually said, and this sums it up, the hospital is a 7-day-week place, and if we are going to say we provide services, we need to provide them well. Reliability matters.
Wow, that quote really hits home. So what's the fix then? What do they say would help?
Well, the answers were pretty direct. Getting consultation requests addressed within 24 hours, that would greatly increase referrals for a whopping 95.9% of them. Having staff available 5 days a week, Monday to Friday, 91.8% said that would greatly help. And even having weekend consultation available, 79.2% saw that as highly beneficial. And interestingly, even though this survey happened during COVID when things were remote, 83.7% still found in-person consultations desirable. So it really points to needing more accessibility, more presence, more integration, making it feel like a readily available part of the care team.
That need for presence, for accessibility is so clear. And thinking beyond just the direct patient work, did the doctor see other roles for psychologists in the hospital? Maybe things we don't immediately think of.
Oh, absolutely. They definitely recognized value beyond the bedside consult. A large chunk saw psychologists enhancing care indirectly, like offering education on behavioral health topics to medical students or residents, 69.4% saw value there, and educating other healthcare staff too, 55%. Many also valued psychologists helping staff with patient management strategies, 63.3%. And even those quick informal curbside consultations, grabbing a psychologist in the hallway for a quick opinion, 42.9% valued those. Plus, supporting staff after critical incidents, helping with wellness programs, it shows the potential impact is really broad, touching the well-being of the whole team, not just the patients.
So wrapping this up, what's the big takeaway for you, the listener? This deep dive really underscores that health psychology in hospitals isn't just a nice to have. Doctors see it as valuable, as critical, really, for complete patient care. It highlights this huge potential to improve patient outcomes, yeah, but also to support the medical teams themselves. But it hinges on making it more accessible, better integrated, and fostering that direct communication. It's a vital piece for genuinely holistic care.
Exactly. And that leaves us with a question maybe for you to think about. Imagine that ideal hospital setting where every patient's needs, physical, emotional, behavioral, are just seamlessly addressed, and where the staff feel fully supported too. What steps do you think need to happen next to make that a reality everywhere, to really weave mental and behavioral health into the fabric of hospital care? Something to mull over.